Hi, my name is Tanika Drake. I'm a family nurse practitioner student at Winston-Salem State University. Nice to meet you. And your name?
Yoshel.
All right, Yoshel, what I'm going to do is a complete head to toe assessment on you. Is that okay?
Yes.
All right, so let me sanitize my hands. We're going to start the assessment off with skin, hair, and nails. So looking at your skin, I'm looking at the color, the texture of your skin. I'm going to feel for temperature. Also looking for any edema, any lesions. Checking the tooger in your skin. I'm going to look at your nails for capillary refill, and that's normal. Looking for clubbing in your nails. So I'm going to have you place your fingers here, and I can see just a little area there. So there's no clubbing in your fingers. Looking at your hair, looking at the texture, distribution of your hair. Everything looks fine. Looking your scalp, feeling for any nodules, any tenderness. Next, I'm going to look at your head. Well, we're going to do the head and neck. So, I'm going to test the sinus, frontal sinus, maxillary sinus. Okay. Looking at your neck and looking for symmetry in your neck, looking for any swelling, looking for placement of your trachea. Next, I'm going to palpate your thyroid. And just swallow. All right. No enlargement of the thyroid. We're going to test cranial. Well, actually, I'm going to test the T and the J. Open your mouth for me. Close. Open. All right. Test cranial nerve 5, trigeminal, and I'm going to have you clench your teeth for me. All right. Cranial nerve 7, facial. Have you close your eyes tightly. All right. Have you smile. And then just poke out your cheeks for me. All right. Next, I'm going to assess your lymph nodes. So first, I'm going to start in the back. Occipital, preauricular, postauricular, anterior cervical, posterior cervical, submandibular and submental, tonsillar, here, axillary, supraclavicular lymph nodes, epitrochlear lymph nodes, and I will do the same on the other arm. I'm going to check the strength in your neck, and that's cranial nerve 11, accessories. So I'm going to place my hand here on your cheek, and you try to press up against my hand. All right. Press. All right. Range of motion in your neck. So I'm going to have you put your chin to your chest. Look up. Okay. That's extension, and that's flexion. Look, rotate to your right and your left. And then lateral movement, ear to you. Okay. Next, we're going to move to assessment of your eyes. Okay. So first, this will be, we're going to test cranial nerve 2, which is optic, and this will be visual acuity test. So I'm going to have you hold that here and read the line that you can see close and cover your eye for me. One eye.
LTFPH.
And the opposite eye.
LTFPH.
All right. And both eyes.
LTFPH.
Okay. I'm going to assess your eyes, looking at your eyebrows, your eyelids. Look up for me. Looking at the conjunctiva, your sclera. There's no drainage. There's no redness, no irritation. we're gonna do the cover, uncover test. So I'm gonna cover one eye while looking at the other eye and looking for any movement, okay? Next, I'm going to test cranial nerves 3, 4, and 6. That's the extraocular movement. Just move your eyes, follow the direction of my hand. Okay. Okay. Good. Next, we're going to check for confrontation in your eyes, your visual field. So cover this eye and I'll cover, and let me know when you can see when it comes into your visual field.
Yes. Yes. Yes.
Okay. Opposite eye.
Yes. Yes. Yes.
All right. Good. And the corneal reflex sensitivity. And just gonna quickly brush the cotton ball by your eye. All right. And reflexes are good. Now I'm gonna take a closer look in your eyes. What I'm checking for is the red reflex and looking at your lenses in your eyes. Good. The next part of our assessment will be ear, nose, and throat. So I'm taking a look at your ears, and they're aligned good. And palpate. Any tenderness?
No.
No? Okay. Take a look inside your ear for any inflammation, the tympanic membrane. There's no irritation in that ear, no debris. I think it's pearly white. We're gonna test cranial nerve 8. We're going to do the Weber test, and that's laterally. I'll place this on top of your head, and you tell me if you can feel it laterally.
Yes.
Okay. Next, we'll do the Rhine test, and I'll just do one ear for now. I'm going to, you listen for the vibrations on the bone, and then I'll put it close to your ear, and you tell me when you hear it stop, and then so.
Yes.
Okay, and I would do that for the other ear also. I'm gonna do a test called the whisper test. So I have you cover one of your ears. I'm gonna whisper just a small phrase, and you tell me what I'm whispering.
1, 2, 3,
The other ear.
4, 5, 6.
Alrighty, I'm gonna take a look at your nose. It's symmetry. There's no deformity in your nose. Palpate any tenderness there. Okay. We're gonna check for patents in your nose. Okay, so cover one nostril, breathe in and out, then the other nostril, in and out. So cranial nerve 1 is olfactory. We're gonna check smell. Cover one of your nostrils and tell me what you smell. Smell that?
Lemon.
Okay. Close your eyes, I'm sorry. Okay. Smell that?
Lemon.
Okay. Alrighty. So I'm going to take a look inside your nose. Alright, now I'm just checking for any discharge or drainage, any swelling. Everything looks good. Next, I'm gonna look inside your mouth, okay? Um, look inside your mouth, and we're gonna take a look at your tongue. So open up for me. Ah, say ah. Taking a look at your gag reflex. That's testing cranial nerve 9 and 10. And take stick your tongue out, move it from side to side. All right, that's testing cranial nerve 12. Okay. You take a more in-depth look at your teeth and your gums. Lick your tongue out and up so I can see under. Good. And then your lips are pink and moist. There's no cyanosis there, no blue color on your lips. Next, we're going to do respiratory. So I'm looking at the way you're breathing, respiratory rate, and your rhythm. There's no respiratory distress present. Okay, I'm gonna palpate. Any tenderness on your lips? No. Any tenderness?
No.
Okay. And I'm gonna have you breathe in and out. That's equal. That's respiratory expansion. Also, I'm going to here. Listen to your breath sounds and just breathe in and out for me. Okay. In and out. Okay. I'm gonna check for tactile fremitus. I'm gonna have you turn this way a little bit and just say 99 for me, okay?
99, 99, 99, 99.
Okay. I will do the same in the front. That's not going to do it. I'll have you say 99 in the front also. And next, we're doing cardio. So with cardio, I'm going to have you lie down for me. Right now, what I'm looking at a 45-degree angle, just looking for any jugular vein distension in your veins, arteries. Everything looks good. Okay. Then I'm just gonna palpate pulsation, aortic, ovarian. Palpate. Auscultate. Listen to your heart sounds. Aortic. Tricuspid. You're mindful. And I will do the same with the bell. That's the second intercostal space on the right. Aortic. Mind. Here. And while I'm right here, I'm gonna check your carotid pulse. And then check. Alright. Check the pulse, the radial pulse. Now I will do the same on each side. I have to just sit up. You can sit up a little bit, just like that. Check the radial pulse. I mean the brachial pulse. Radial. Popliteal. The posterior tibia. And then the pedal pulse. Okay. And I will check for the temperature and any edema present, and there's none present. All right, next, I'll have you just scoot up some for me. And actually, see which way we can get, because we're going to do your upper extremities, musculoskeletal. So I'll have you, first, I'm going to palpate your shoulders. All right. And palpate your wrists, your hands, metacarpals for any deformities. Palpate your shoulders, scapula, palmeo. We're going to do range of motion in your shoulders, okay? So, I'll have you flex out, and down, out, abduction, all right, across, adduction, all right? Then I'll have you go back, extension, okay? And then internal rotation here behind your back, all right? And then the opposite way, external rotation. All right. And with your hands, I'll have you, or your elbows, 90-degree angle, just here. And supination and pronation. Here. And out. And in. All right. Okay. Then I will check for carpal tunnel syndrome. So it's called the Phelan test. So I have you. Any pain? No. Okay. And then the near and impingement test here. I'm just gonna bring you up and down. Any pain? No. Okay. Next, we're going to do. We'll go ahead and do your abdomen. Okay. So I'm gonna have you lie down here. With your abdomen, what I'm checking for, if you have your stomach, if it's concave, if it's flat, pulsation in your abdomen, and your second, what I'll do is have you lift up just so I can look at the muscles in your stomach. Good, right there. All right. I'm gonna auscultate in all 4 quadrants. Checking for frequency. And got a button here, the aorta, artery, renal, iliac, femoral. And I would do the same on that side. Next, I'm going to percuss in all 4 quadrants. That's good. Next, I will, I'm going to palpate, and it just be a light palpation Well, actually, before I palpate, I'm gonna percuss over the liver span. Okay. So have you breathe in. All right, and out. Okay, that looks good. And I'm going to percuss over the spleen. Breathe in. And out. And it's tympani. Okay, good. Check for placement of your spleen. I mean, not your spleen, your liver. Here. And the spleen. Check for placement of your kidneys. Right kidney. And then the left kidney. All right, I'm gonna have you sit up for me. Check the CVA and this any tenderness in your kidney area, okay? That hurt?
No, ma'am.
Okay, all right. I have you sit up for me. We're gonna do the lower extremity. So, I'm gonna palpate your, we'll go ahead and have you stand up. Look at your spine. Looking for symmetry, okay? And I palpate your spine. Because spine, I'm gonna have you just range of motion, touch your toes for me. Look at the alignment. That's good. All right. And back. All right. Flexion. All right. Extension. And I'll have you rotate to the side. And then lateral over. There you go. And over. All right. Have you sit down for me. So I'm going to palpate your knees. Patella. Your ankles. Achilles. Your toes. All right. So what we're going to do now, we're going to do range of motion in your, we'll do your hips. So I'm going to have you lie down. I'm going to have you bring your knee to your chest, okay? All right. Extension. Flexion. And then extension here. Okay. And now bend your knee, right angle. And this is external, internal. Alrighty. All right, I'm gonna have you sit up for me. And come to the edge of the bed. And we're gonna do range of motion in your knees. So I'm gonna have you just lift your knee up, all right? And that's extension and back, and that's flexion, okay? And then I'm gonna have you turn your leg in and out, okay? And I'm gonna have you bring your foot up, dorsiflex, down, plantar, and I'll hold here, in, out. Okay. So I'm gonna test the strength in your elbows, okay? Or in your shoulders. So you just try to push up against. Okay, good. All right. Test the strength in your knee, and just try to push up. Okay. Strengthen your feet. So like your pressing on gas, okay? All right, and then up. Okay. All right, so that is your lower extremities. That. So we're gonna test sensory. And this right here, the sensory part of your nervous system, this will be sharp, this will be dull. But I'm gonna have your eyes closed, so you tell me when you feel sharp or dull, okay? All right.
Dull. 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 Sharp. Sharp. Sharp.
Okay. Also, another sensory test. Close your eyes, hand out, and feel, and tell me what this object is.
A safety pin.
Okay, thank you. All right, my next, we're gonna check your coordination. Okay, so hands on your hips, and then just kind of back and forth on your hips, and how fast you can. Just how you, yeah. All right, perfect. And we will do the chin, your heel on your shin. And what I want you to do is put your heel on your chin and just go right down. All right, perfect. Last, well, not last, I'm going to check your reflexes, okay? So we'll start with the reflexes in your tricep. Right. And biceps. All right. Patella. All right. And the Achilles. All right. And I would do the same on the other side. I'm gonna have you lie back just for one quick second. We're gonna check the reflexes in your abdomen. All right. I'm gonna have you stand up. This is the Romberg test. So I have you stand, just come really close, close your eyes, and feet together. I'm checking for the gait, okay? Close your eyes. All right. Put your arms out for me. Close your eyes. All right, you have good gait. So what I'm gonna have you do, you can back up just a little bit, and I'm gonna have you walk from heel to toe, okay? Just a few steps from heel to toe. And that's perfect. I have you sit back down. And this concludes my head to toe assessment, and I thank you for your time.
Thank you.